Aloha and welcome to Conversations. On this week's episode, we have the pleasure of hearing from the Arcadia Medical Director team, Dr. Pia Lorenzo, Dr. Lauren Okamoto, and Dr. Kamal Masaki. The topics that they will cover include a general outlook of COVID-19 response from the Arcadia Family of Companies thus far from a medical director's perspective, reminding us all the best way to fight this disease is through staying at home, social distancing, hand hygiene, and making sure that we wear our masks. And finally, sharing our organization's stance on universal testing. Let's hear now from our medical director team.
Hi everyone, I'm Dr. Pia Lorenzo. I'm a board-certified geriatrician with the Department of Geriatric Medicine at the University of Hawaii. I'm also the medical director of 15 Craigside, and I work closely with Dr. Lauren Okamoto, who is the medical director of Arcadia. I can confidently say that Craigside and Arcadia are doing well. We are at par and maybe even doing better than other senior communities on the island. We have excellent infection control training for our staff. We have great emergency preparedness policies, and we have a healthy supply of personal protective equipment, or PPE. We have found creative ways to communicate with everyone despite social distancing so that everybody can be kept in the loop. I'm also proud to say that we have even been pioneers in the community. Craigside was the first senior community to offer telemedicine. We got the system up and running in 2 days, which is no small feat. Arcadia followed a few days later. Our day-to-day lives will continue to be impacted for a while until majority of the general population gains immunity. The safest way for this to happen is by getting vaccinated. As of today, there's no vaccine yet. Scientists around the world are working on it. The projected time to produce a vaccine is around 1.5 to 2 years. Why so long? It is because the virus is unlike any other virus that humankind has ever encountered before. Scientists all over the world are trying to make this vaccine from scratch. Once a vaccine has been invented, they have to make sure that not only will the vaccine be effective, but that it is safe and without major side effects. There are also some promising medications on the horizon to treat the illness. But again, these are far from a sure thing and are all still experimental with regards to effectivity and safety. Until then, we will need to focus our efforts on preventative measures.
Hello everyone, I'm Dr. Lauren Okamoto from the University of Hawaii Department of Geriatric Medicine and Medical Director of Arcadia. As you know, the Arcadia Family of Companies is concerned first and foremost for the safety and wellness of its residents, employees, and extended family. The first and perhaps only defense we have against COVID-19 is to prevent its entry into our facilities. In the very unfortunate circumstance that COVID-19 does get in, the only defense is to already have certain infection control measures in place. What this means is frequent hand washing for a total of 40 seconds, with actual 20 seconds of actual scrubbing or singing the song Happy Birthday ×2, and using hand sanitizer with at least 60% alcohol content. We hope you are abiding by the universal mask policy, and what this means is wearing a cloth or surgical mask when in common areas of the facility and even if going outside. As a reminder, please avoid touching your eyes, nose, and your mouth without washing or sanitizing your hands first. Continue to refrain from social gatherings, even in private areas. Please avoid going out in public unless it is for an essential need. We'd like you to continue social distancing with staying at least 6 feet apart from one another to prevent virus particles from transferring from one person to another. Now, COVID-19 is a really sneaky virus and will trick us to thinking it's not there. Small children and healthy adults may not feel ill or have any symptoms at all and still be spreading the virus. We are in this together and we will get through this together. So hang in there and stay well. I hope to see you soon in person. Thank you.
Hello, I'm Dr. Kamal Masaki, and I'm the chair of the Department of Geriatric Medicine at the John A. Burns School of Medicine at the University of Hawaii. Some of you may be wondering whether everyone in the facility should be tested for COVID-19. The staff of the Arcadia Family of Companies have discussed this with the Department of Health, and at this time the decision is not to test everyone. If there was to be a positive case at any of the facilities, this could change. If you develop any symptoms, please let the staff know right away. As more becomes known about this virus, new recommendations may be issued, and our faculty and staff are in constant communication with the Department of Health so that we can do our best to keep all of you safe. Your two medical directors, Dr. Pia Lorenzo at 15 Craigside and Dr. Lauren Okamoto at Arcadia, are both fellowship-trained and board-certified geriatricians who are very well qualified for their positions. They are also very caring physicians. They are working closely with Susie and her wonderful staff, and we will get through this crisis together. All the best to you and your families, and please stay safe.
Mahalo to Dr. Lorenzo, Dr. Okamoto, and Dr. Masaki for sharing their insights, their guidance, and the direction with us this week. As we begin week 8, I want to remind all of us that COVID-19 is a marathon, not a sprint. Just because the government is beginning to loosen restrictions for low-risk businesses does not mean that healthcare providers such as the Arcadia Family of Companies can or will do so. We are home to the most vulnerable population in this pandemic, and we must ensure the health, welfare, and safety of all of you. I ask that we continue to watch out for each other, take care of one another, and make sure that we stand strong against COVID-19 so that we do not allow it to enter Arcadia or 15 Craigside. Thanks again for joining us, and we'll see you next week.